Hi, everybody. Welcome to my YouTube channel, Cannabis is Medicine. This is Bonnie Goldstein, and today I'm going to talk about how to take medical cannabis. So if you don't know me, I'm a California licensed physician for longer than I'd like to admit, pediatric trained at Children's Hospital Los Angeles, where I also worked in critical care transport and pediatric emergency medicine for many years at the LA County USC Medical Center, as well as some other emergency rooms in Los Angeles. I've been the medical director and owner of Canna Centers since 2008 after witnessing a friend use cannabis with tremendous benefit as she was fighting cancer. I'm a board member of the International Alliance for Cannabinoid Medicines. I'm a board member for the Center for Scientific Cannabinoid Information, as well as member of Americans for Safe Access Policy Advisory Committee and the Society for Cannabis Clinicians member. I'm also clinical advisor to a company by the name of Pharmacokinetics. This is a picture of my book, Cannabis is Medicine, where I try as much as possible to educate you about cannabis as a safe, effective option for many different conditions. So a question I get asked all the time, hey doc, what's the best way to take cannabis? So the best way is the way that works best for the individual who's using it. Although we all have very similar physiology, we are all very different in the way we absorb and metabolize all kinds of compounds, including the compounds from the cannabis plant. So luckily, cannabis has many different ways that it can be used. Some patients use one way, some patients use combination, depending on how they respond. And so this video is going to go through all the advantages, disadvantages, and other details that you will need to be able to make a decision on how to use cannabis for your particular needs. So first, let's talk about something called pharmacokinetics. This refers to movement of a drug through, and out of the body. So it includes absorption, distribution into the various tissues of the body, metabolism, which is the breakdown, and then excretion. How does it leave your body? And cannabis is different from other medications like pharmaceuticals that people take for conditions, in that cannabis is a botanical, herbal conglomeration with many, many compounds, over 500 different compounds described in the cannabis plant, many of which are medicinal. And we're comparing that with the pharmaceuticals, which are single molecule, usually synthetic, where when studied, it can be easily determined how that drug is absorbed and distributed and metabolized and excreted. But with cannabis, it's very different because there's so many compounds and they're targeting multiple different places in the body. They're being distributed, and how you take them determines how much you absorb. And then they're all metabolized, and some of the byproducts of the metabolism can be active, and then they're excreted. So it's important to understand that it's sometimes difficult to predict how any one person is going to respond to cannabis. And this is why you'll see at the bottom here, it says start low and go slow, right? Because we want to be very careful that we're not just taking a large dose right out of the gate and experiencing something unwanted. Be aware there's what we call a large inter-individual variation. And we all probably know people who love THC and people who hate THC. It might be that the people who do not like the effect of THC, they don't metabolize it very well due to their genetic makeup. And so THC stacks in their body and they can't seem to break it down, and that can leave them with unwanted side effects. So we're all different in the way we respond. It's definitely not one size fits all, but it's important to understand that you can learn how cannabis is absorbed, distributed, metabolized, excreted in your body by trying the various different methods, which I'm going to go over, so that, again, you can dial it in so that you can make it work best for your particular physiology. So let's start with inhalation. Of course, this is a very common way that people use cannabis. You can either smoke the flower, what we call the dried cannabis flower, or you can vaporize the flower, or even oils are made to be vaporized. And one of the big benefits of this is the onset is within minutes. Certainly people are having a rip-roaring migraine, or you're vomiting after chemotherapy. This is a nice way to treat because it gets in through the lungs with some reasonable absorption and efficiency. And it's usually peaks at about 30 minutes. So you kind of know your dose within that first half hour. Most people figure it out very easily what 1 puff, 2 puffs, 3 puffs does for them. And the duration is not terribly long, 1 to 4 hours. But I do find that for some people, for instance, someone who might wake up with high anxiety in the morning and they take a puff or two, it kind of resets the mood for the rest of the day, even though the effects, let's say, of THC are not lasting throughout the day. So it can help to kind of nudge or adjust pain or mood or nausea with a low dose. And it's usually worn off fairly quickly, especially if you're more experienced or over time use cannabis. You'll find that maybe you only get 1 or 2 hours, but it kind of sets you up for the rest of the day to not have the symptoms that are bothering you. So for most people who have not inhaled before, they are often reluctant to inhale. However, understand that vaporizing is not very noxious for the most part, and may be a way, if you're in a situation where you need rapid onset, you should consider this. Now, again, benefits: rapid onset, easy to dose, and the short duration of effects. But disadvantages: well, if you have terrible chronic pain, short duration of effects is not a benefit. So it really depends on what you're treating. There certainly can be airway irritation. We know that we sometimes see more cardiovascular side effects from inhalation, meaning your heart can race, and maybe if you take too much, your blood pressure may go down. And so that is much more common with inhaling than any of the other ways to take it. But also we know that, and some of my other colleagues out who practice cannabis specialty have noticed this as well, is that there, especially with joints, there may be a quicker development of THC tolerance, which is interesting. However, remember, you can always reverse tolerance by reducing the amount you're using or taking a break or including CBD in your regimen. Sometimes changing the chemovar of the flower that you're using can also help you reduce tolerance. Now, in terms of tips, so smoking joints, as I've mentioned, may lead to development of tolerance. It's interesting. A lot of people think the water pipe or bong method is filtering to kind of eliminate the combustion byproducts. And actually, it turns out that it really doesn't filter out the harmful compounds, but it's actually more likely to filter out the cannabinoids. So you're actually taking away the medicine. And it turns out that there was a study that showed that people who used bongs needed to take more puffs in order to get a similar level of THC as they got with other inhalation, either a pipe or a joint or vaporizing. So remember that that idea that the water pipe or bong is filtering out the harmful compounds is not necessarily true. There's certainly something to cooling off the smoke. However, be aware that you are wasting your cannabinoids as they get into the water. Vaporizers, on average, people talk about 315 to 420 is the temperature, depending on your response. This is a pretty wide range. There are many vaporizers out there that have a temperature gauge, so you can set the temperature to what works for you. Most people start around 350 and then start to dial up to see what they get. Flower vaporizers have been shown to eliminate most of the combustion byproducts that are in the smoke when lit on fire. For some people, vaporizing may be more cost effective. Now, it may have a slower onset of action versus smoking, and this has been reported by some of my other colleagues as well as by my patients. So rather than within 5 minutes feeling it, maybe 10 minutes or 15 minutes is when patients feel it. Some patients report that they don't get the same effect, and that may be because at the temperature at which you can vaporize, which is before the material combusts, you may not get all of the compounds, especially the flavonoids that are in the cannabis flower. So you may not be getting the exact same makeup of the medicine that you get if you were to light it on fire. Surveys show that vaporizing has less respiratory side effects. And in many of my patients who have switched from smoking to vaporizing, they certainly report that they have less phlegm, less coughing, and overall have reported a benefit. But I would say about 20% of my patients who tried switching from smoking to vaporizing said it wasn't the same result. And often what my patients will do is they will go back and forth between either smoking and then vaporizing just to reduce the overall smoke that they're putting into their lungs. For new patients, really, you just want to take one puff and then wait at least 10 to 15 minutes, and then you can repeat another puff to see what that does, and so on. But it is important not to just puff out at the beginning, because remember, there's going to be a peak at 30 minutes where you may be uncomfortable if you take too much. Remember that the flower that's available now is quite potent, and it really doesn't take much to get a medicinal effect. Now let's move on to sublingual, which means that you're holding it under your tongue. There's different ways to take this. You could see I have a picture of a cannabis tincture or oil. Tincture infers that there's alcohol, although many of these products don't have alcohol in them. However, the kind of cannabis industry calls these tinctures. They really are extracts. And you can see there too a little green cannabis film strip, or what we call a sublingual strip, which then you would hold under your tongue. There's also companies that make tablets. The onset for these types of products is usually somewhere between 15 minutes all the way up to 60 plus minutes. There are some people who report that they don't feel it for about an hour and a half after taking it. Peak effect is usually 1 to 2 hours, and duration is 6 to 8 hours, although it may be slightly less or slightly more depending on the dose and your body's physiology. The benefits, certainly no equipment, very discreet, there's no odor. Tinctures, I find, allow for accurate dosing, and which also allows for incremental titration. So for instance, when I have a pediatric patient and we're introducing THC, we want to be able to measure out 0.5 milligrams or 1 milligram. Remember, you can't really do that with other products to be that small and that accurate. So I do find that the tinctures allow for that. Now, disadvantages, delayed onset. So again, if you're feeling that migraine come on and you want immediate relief, this may not do the trick. And that's why many people who, when they feel pain coming on and they know it's going to escalate very quickly, they will inhale in order to abort that pain or minimize that pain. They certainly don't want to wait an hour and a half if that's how long it takes for a sublingual product to kick in. One of the other things is these products really don't taste that good. Many patients say they're very frankly, yucky or nasty. And some people have to hide them in either peanut butter or yogurt, or a scoop of pudding or something. Certainly you can do that and still hold it under your tongue. And one of the other disadvantages certainly is the variable onset and duration. And again, it can vary depending on the product and on the person. And so once you learn how these work for you, though, if you try them and you pay attention and keep a log, you will probably notice a pattern that maybe for you it takes 1 hour to kick in. And then this way you know that if you're using it, let's say before bedtime, you might want to take it an hour before you plan to go to sleep, so that you don't have that hour laying in bed with your back pain before it kicks in. Now, these can contain oil, as I mentioned, or alcohol, other ingredients as well. I've seen all kinds of things like other components like melatonin or chamomile or glycerin. And so please always check the label to make sure there isn't something, one, that you're allergic to, or two, that you really don't want in your medicine. These are also available, as I've already mentioned, as the film strips, but tablets, and also something called troches, which are like little, almost like hard little sucking candies that are meant to dissolve slowly in your mouth. There are some of those out on the market as well. Now let's move on to what we call edibles, or enteral, meaning going through the gut. So anything that you would swallow down into your gut is something that you would call an edible. So remember, if it's sublingual and you're holding it under your tongue, let's say for 2 minutes, and then you swallow it, some of that medicine will be also considered enteral. The onset of effects for most people is somewhere between 1 and 2 hours. However, I have seen up to 4 hours, even 6 hours in a patient, which to be perfectly honest, was not working very well, because when you have pain, you do not want to wait that long for your medicine to kick in. The peak effect is usually about 4 to 6 hours, and the duration is 6 to 12 hours. And again, there's a lot of inter-individual variation, so be aware that these numbers may or may not apply to you, as again, we're all a little bit different in how we absorb, and also the makeup of the product, and also how much you take, the dosing. So benefits, longer duration. So many chronic pain patients prefer to take edibles because they get 6 to 8 hours of pain relief, even 12 hours. They only have to medicate 2 or 3 times a day. Another benefit is that it's discreet. Also, you can make your own. So you can make it as strong as you like, or as weak as you like, by, let's say, making cookies or brownies and using a very low potency flour, just a small amount of flour. I do find that many patients are able to make their own, cut it into small pieces, and it's very cost effective that way. Also, edibles help to increase the duration of sleep for some, which I'll explain on the next slide. However, disadvantages for some people, edibles can be too sedating. Some people don't want 12 hours of effect, so that long duration, again, can be a disadvantage if that's not something you're looking for. Additionally, some people find it very difficult to find the correct dose, and that's usually due to the fact that we have erratic and unreliable absorption of these of edibles. And first of all, it's just the nature of what happens anytime you eat anything. Now, if you have fat at the same time that you take an edible or even a sublingual, that will enhance the absorption. But sometimes it's very difficult to find the correct dose because it's the product itself maybe doesn't have the same amount of THC in every little piece. And so it's very important that before using an edible, you understand exactly how much is in each piece so that you can customize the dosing to a small dose to be able to account for some of the changes, which I'm going to discuss. So you absolutely want to know how long it takes to kick in and how long it lasts for you, because you do not want to have, let's say, if you take it at night, a morning hangover. And usually if I see someone who complains of a morning hangover, it's that they took too much or they took it too late. So that's why dosing and timing is very important. And additionally, the dosing, the product, and the actual strain or chemovar that was used to make the product absolutely matters, because that will determine whether or not this will have more of a sleepy effect, more of a pain relief effect, more of a stimulating effect. So you really do want to know what is in the edibles. I do find that some companies label their products very nicely, meaning you know the strains that are in there, you know if they're expected to be used for sleep or not. And some products are just kind of not labeled, and it's a little bit of a buyer beware situation. Now, this is very interesting. So when you ingest THC through your gut, it is metabolized by the liver. And we call that either the first pass effect or the liver effect, some people call it. And this is the very important part. THC is converted by your liver to a compound called 11-hydroxy-THC. And this is a byproduct that is, or a metabolite, which can be quite intoxicating or impairing, and also quite sedating. And it can be quite uncomfortable for some people. Some people do not like the way this makes them feel. But this is why we want you to start low dose, because you have no idea how much of the THC is going to be converted to this, and whether or not it's going to be unpleasant or uncomfortable for you. So for anybody who's new to using an edible, I highly recommend you start with either 1 or 2.5 milligrams, somewhere in there if you can measure it. if you're new to this, and you wait at least 2 hours before repeating the dose if you don't feel it. As I've mentioned, absorption is enhanced with ingestion of food with high fat content. So again, any kind of nut butter, avocado, eggs. Some people take pudding. Some of my patients use high fat yogurt. Really up to you what you want to take with it. But we do know that there is an improved absorption with food that has high fat content versus fasting, taking these on a stomach that is empty. Be aware that you can overdose on THC. It's not fatal, but it can be very trippy and very uncomfortable. And taking an edible dose that is too much, and remember, not accounting for that conversion in your liver to a compound that also adds to the intoxicating effect. This is the most common cause of a THC overdose, which is, you ate too much of the cookie or the brownie. Be aware that the effects will wear off. Nothing bad will happen. Usually somebody reassuring you at the time that you're uncomfortable will help. But in general, by starting very low dose, being patient and titrating up as needed in very small incremental amounts will allow you to avoid any type of uncomfortable overdose situation. Now let's talk a little bit about cannabis tea. So remember, the plant, before it being heated up, mostly contains what we call the acidic cannabinoids, THCA, so tetrahydrocannabinolic acid, CBDA, cannabidiolic acid. So the acid just refers to the structure. And remember that when we heat up THCA, it converts to THC. That's why people heat up by either smoking or baking in brownies. CBDA converts to CBD. So if you buy a bottle of CBD oil and it's labeled right on there, CBD, you know that that product was heated up from the plant to create that CBD content. Now, when you're using cannabis tea, usually putting just some cannabis flower into hot water will not necessarily convert. It won't be hot enough to convert the THCA and the CBDA to THC and CBD. And studies show that you can get kind of a nice amount of these acidic cannabinoids, which, by the way, I have another YouTube video coming out. If you don't see it, it'll be out shortly, about THCA and CBDA and their very helpful medicinal properties, which namely very potent anti-inflammatories. They can also help with nausea. They also have some anti-cancer effects. So many patients do enjoy a cup of cannabis tea and find that their inflammation is going down. So for instance, a patient with arthritis may just start taking some cannabis tea in small amounts, and over a period of a few weeks will report back to me that they are having less pain in their joints with very minimal intoxicating or impairing effects. What you can do is add a small size, a pea-sized amount to start with, and then increase as needed. You can add it to hot water or to other beverage. I know some patients who put it in bone broth that they heat up, that they drink for that's medicinal benefits. And again, good anti-inflammatory with little to no impairing effects. Obviously, if you add a little bit of milk or other high-fat almond milk or something to your tea, you may enhance the absorption, and you may find that to work better if you like that in your tea. Now let's talk about topicals, so balms, salves, creams. These are applied directly to the skin. The onset of effects for many people somewhere between 10 and 30 minutes. And again, the peak effect and the duration varies. It just depends on, of course, the person, but also the product that you're using, how many milligrams are in it, what other ingredients are in there. And so it can certainly vary. The benefits include no systemic effects. So you're not going to have to worry about any intoxicating or impairing effects. It does not penetrate the bloodstream. So drug test will be negative. And there's a study that shows this. I also have patients in my practice who get drug tested for work who are able to use topical cannabinoids without having a positive drug test for work. And then the other benefit is you can just apply it to the specific area of concern. So remember, when you're taking it internally, you know, you're kind of signing on for a systemic effect, whereas topical is very local. So if it's just your left wrist that hurts, you can put your topical on your left wrist and not have to worry about having any other systemic effects. Now, in terms of disadvantages, I haven't really seen too many disadvantages with this, other than it may not penetrate the skin well, depending on the product. If it's not made well, or there's a low milligram amount of THC or CBD. But other than just buying a product that didn't work and wasting money on that, there really are no disadvantages to the topicals. From studies, we know that CBD may penetrate skin better than THC. I have used this very successfully in patients with arthritis and nerve pain like neuralgia or neuropathy. Also, we know that these topicals can help with rashes such as eczema or psoriasis. And of course, you always want to read the ingredients to make sure that you're not putting something on an open rash that could be irritating that rash. There is evidence from the research that shows that topical cannabinoids, especially THC, may be very good for what we call pruritus or itching. There's studies on people who have renal failure who get very itchy skin, and there's clear evidence that topical cannabinoids can help reduce the itching. Also, there's a study on a few children who have epidermolysis bullosa, which is a horrific skin condition, and there's evidence that it can help with this. Now, it's important. These products are not standardized. You know, I can go buy 10 different cannabis topicals and they're going to be all different. And so make sure you read ingredients. My recommendation is to go for the higher milligram amounts if you're using this for severe pain. I do find the combination of CBD and THC often most effective, meaning not just CBD only. It doesn't have to have a lot of CBD if there's a lot of THC or vice versa, but I do find the combination seems to work better for most patients. And then also products containing camphor or menthol, which kind of help these cannabinoids penetrate the skin better. Or look, I have some patients that will take an over-the-counter product that is meant for achy joints, let's say, and they'll put that on, and then they put their cannabis on top, and the combination seems to work really well, better than either by themselves. So you can mix and match with some of the other topical products that are on the market if you wanted to see if that helped with better pain relief or penetration. Now let's talk about transdermal patches. There are very few studies. I did post here at the bottom of the slide a very nice report from February 2022 about the transdermal delivery of therapeutic cannabinoids. You can just Google this and read the article. It does go through what we know so far, and it's a very nice report. These patches are applied directly to the skin with the expectation that it's going to penetrate the bloodstream, so different than topical. Many of these products contain what we call permeation enhancers, which help the cannabinoids get through that layer of skin that is supposed to keep things out and help get these cannabinoids into the bloodstream. I do not have that many patients that have used these. However, here and there, patients have reported some benefits. Some patients are not too happy with them because they developed a rash, because there are some of these other compounds or ingredients. So always important to read the ingredients to check for any kind of allergen or anything else that might be in there that you do not want to have in your medicine. And also be aware that the effects with one patch for some people, and also reported in animal studies, can last up to 72 hours. So for some people, this is nice. You slap on a patch for your back pain and you kind of go about your business. But of course, you always want to test a patch when you do not have anything else to do, in case you do absorb too much THC or it lasts too long in your system. So it's always good to do a little trial before it would be something that you might use before you go about your regular activities. Now let's talk about rectal or vaginal suppositories. So again, we have scarce data. There's just a few reports here and there in the scientific literature, and some of them are conflicting. And again, it's due to the fact that different study products and different methods. If you look at kind of all the studies with cannabis, no one's really using the same thing. So it's very hard to compare apples and oranges. Right now, what we have showing in the studies is that cannabinoids do not get absorbed very well through the rectal area unless there are permeation enhancers, meaning other chemicals that are mixed in that help pull the cannabinoids through into the bloodstream. We do know that there's a study on rectal CBD in animals that was helpful for colitis. So it's almost like a topical. If the colitis in the rectal anal area is inflamed and you put topical, like a CBD suppository, that's basically like rubbing CBD. It's a topical use, and that can be helpful for colitis. I have seen cannabis suppositories help with hemorrhoids, anal itching, anal pain from fistulas and these kinds of things. Some women do report vaginal suppositories to help with pelvic pain or vulvar pain. And certainly that's something that you can try. But again, make sure to read ingredients to make sure that you don't have anything in that particular product that might be an irritant. Patients undergoing chemo. So there's a lot of talk about cancer patients using suppositories to be able to get high doses into their bloodstream without them feeling high. And number one, anybody undergoing chemo should not be using any type of suppository, much less a cannabis suppository. And part of that is because if we all know that the anal area has a lot of bacteria, when you're undergoing chemo, you have a suppressed immune system, and you can get what we call sepsis, which is when bacteria gets into your bloodstream by irritating the anal area, by putting in a suppository. If that bacteria penetrates into the bloodstream through an open blood vessel or something like that, those patients can have a very serious risk of infection. So we certainly don't want to see that. And so in general, I don't usually recommend rectal or vaginal suppositories. Here and there, I have patients report that they can be helpful. However, my overall feeling is there's other ways to use cannabis with much better absorption and certainly more cost effective. Now, here's just some examples of use from my practice over the years. So this is a 58-year-old male came to me with insomnia, low back pain, and anxiety. He had a history of smoking cannabis years ago. He liked it. It was helping him with all of these conditions. However, he got a new job and was getting drug tested randomly. So he decided that he wanted to keep his job. So he decided to stop using cannabis. And then he recently left the job and had been using sleep aids and some over-the-counter pain medications, and he wanted to get off those other medications. And so he began using inhalation early evening with a vaporizer after he was kind of in for the night. And he said it helped tremendously with pain, low back pain, and his stress. But he wasn't getting a good night's sleep. He was able to fall asleep, but he couldn't stay asleep. So what we decided to try was 2 hours before bedtime, he was taking a 5 milligram THC gummy and finding that he was able to sleep through the night. During the daytime, when he wasn't interested in necessarily being under the influence of THC, he would apply the topical cannabis to his lower back with very good results. So he came up with this, and I worked with him to come up with this very nice regimen where, as you can see, he's including inhalation, he's including edible, and he's including topical, all low dose, all very effective. And he was quite happy with this result. Very easy and easy to follow. And even if he missed a dose or didn't apply topical, there was no downside to this. He was getting the results, and he was able to stop those sleep aids and the over-the-counter pain pills. Now, here's another patient that came to me. She was 72 years old, and she had very severe insomnia, despite being very healthy. She was an avid walker. Every day went out and walked, miles with her friends. She had trouble falling asleep and trouble staying asleep, to the point where she said that she dreaded nighttime. She just could not, as night fell, she could feel that anxiety of, oh no, another bad night. And it started to create some real issues for her. So what we did was we initially tried some sublingual tincture, THC dominant. I find THC works really well for sleep, and it's very cost effective because you don't need a lot. And it helped her fall asleep, but she was still waking up in the middle of the night and then unable to go back to sleep. And we even tried redosing, but it took like an hour and a half to kick in. And so then she would lay there waiting for it to kick in. And then she said that then she would sleep too late in the morning, which didn't work for her. So what we did was we switched to a little chocolate candy bar that each little piece was 2.5 milligrams. And she started taking that, I think about 2 hours before bedtime. And that helped with her onset of sleep. And then she was getting 7 hours of sleep, which she was very happy with. So this was very easy for her to do. She actually liked the taste of the little chocolate, and it seemed to fix the problem. And I will tell you that we all talk about tolerance with THC. She kept her dose at 2.5 milligrams. If she had stacked, let's say 4 or 5 nights in a row where she slept really well, sometimes she would just take a break and not take a dose. And she would say sometimes she slept and sometimes she didn't, but she always knew the next night she would be able to take it again. And because when we had talked about development of tolerance, she said, well, I'd rather just skip one night than have to take, more time off. So for some of my patients with tolerance, if they're using cannabis on a regular basis to deal with pain and sleep and anxiety, sometimes their dosing will escalate as they use it over a long period of time, and then they have to take a break to reset their receptors. And they really don't like taking that time off. And so this particular patient said, I'd rather skip one day a week than have to take a week off every quarter. So that seemed to work very well for her. Here's a 42-year-old male. He was a high stress business owner, father of 4. He had a chronic back pain from a sports injury. And he said, during the day, his back didn't bother him too much. He said he was very busy during the day and wasn't paying attention. But it seemed that when he laid down at night, he would get this sharp pain, achy also, and he just had difficulty falling asleep. And he began using a topical CBD, THC in a 1-to-1 ratio. And that helped alleviate the back pain. I encouraged him to use it in the morning as well, to see if there was any way, morning and night, we could start to maybe reduce the inflammation in the area. And then he started using a vaporizer with THC dominant flower. And I wrote GDP, which is Granddaddy Purple, which is kind of a well-known chemovar that is sedating. And he would take a few puffs at night before bedtime. And he was able to then fall asleep, and he was able to sleep through the night. He never really had trouble sleeping through the night. It was just a matter of falling asleep. So he wanted to just take something that would not last all night long in case he had to get up to deal with his children, or if he had to get up early for work. And that seemed to work very well for him. And then here's my last patient, 82-year-old female who had arthritis, neck pain, insomnia, and anxiety. And that's all wrapped together. For years and years, she struggled and tried everything under the sun, and apart from cannabis. She was cannabis naive. And when she first came to me, she said, I don't want to take THC. I'm afraid. I only want CBD. And so we started her on a CBD tincture, 25-to-1 ratio under the tongue. And because of her age, we started low dose, 10 milligram twice a day. And we titrated up every 4 days by 10 milligram increments. So 10 milligrams twice a day, 20, 30, and so on. And she found 50 milligrams twice a day alleviated the pain. And she reported from 8 to 10 on a pain scale down to 2 on a pain scale. That's pretty impressive. On days where she would have some breakthrough pain, she used the topical CBD and THC combination, a 1-to-1 for that breakthrough, especially during the daytime. She was able to do that. At night, sleep was improved, but she still had frequent wake-ups, and that's not uncommon for someone her age. As she had kind of gotten used to using cannabis, she saw that she could control dosing, that the side effects really didn't exist for her. And she was willing after some time to try THC because she was seeing great results except for this middle of the night waking up. So we added in a 2.5 milligram THC gummy, and we increased in 2.5 milligram increments. And what she found, and again, she tried the 2.5, let's say 2 or 3 nights in a row, and then she tried 5 milligrams 2 or 3 nights. And we found 7.5 milligram dose to be the most effective. And someone might say, gee, that seems kind of high, and she's older. Remember, this is based on her results, on her absorption, her metabolism, what she requires. Some of my elderly patients who I've been following for many years can take 20 milligrams of THC at night. They've developed a little tolerance to it. They're older. We know the endocannabinoid system goes through changes in the elderly. You have less cannabinoid receptor density, and it may be that you just need a little bit higher dose. But again, always starting low and titrating up. Now, you might ask me, why do I use THC at night? Notice the past few examples. I just find that to be the most beneficial or the most effective for helping someone sleep through the night who really struggles with sleep. However, I've also found that a CBD, THC in a 1-to-1 can help people, some people sleep. Remember, in other videos that I've done, you may have learned that CBD in low doses can sometimes be overstimulating or alerting. And there are some people who cannot take CBD at nighttime because it will actually give an opposite effect for sleep. It may actually make them more alert. And there are some studies that show that up to 25% of people can have this type of response. So if you are using CBD at night and you're worried or you're found that it's not really helping with sleep, if THC is legal in your state or in your country, you may want to switch to a low dose THC to try that instead. All right, so some helpful suggestions. So in my book, I talk about a method called rule it in or rule it out. So basically ruling it in means that you are in the process of having a product. You're going to start low dose. You're going to titrate up and see if you can find a dose that gives you the desired effect without side effects. If you can find that, whether a low, medium, or high dose, you have ruled it in. That is now something that you can use as part of your regimen. If you find that, oh, if I go a little bit higher, then I get too many side effects. And let's say, 50 milligrams of CBD gives me this best benefit, but there's still room for improvement. But if you go higher, you get side effects, then you may want to then add in another compound or try a different product similar to the one that you're already using to see if you can make it work better. If you try a product and low dose, medium dose, high dose does not work for you, you have ruled it out. Take it out of the equation and move on to something else. If you're going to do it in this method, I highly recommend you keep a log of the products, the dosing and the response, so you can always look back and say, oh yeah, you know what? I've already tried something like that. I'm not going to try this. Maybe it's time to move on to that. Often a combination of different cannabinoids or products provides the best results. I see that all the time in my practice. And again, you may need to try different cannabinoids to find the best results. You may not be a person who responds to CBD. There's a lot of people who don't. They find CBG works for their anxiety. So it's important to understand that just because one cannabinoid may not work for you, other cannabinoids may do the trick. There's a lot of overlap in the effects of these compounds. And one last thing to mention, I find a lot of patients, once they start using cannabis medicine successfully, after a few months, they actually find that they don't need as much. And this is unusual because we don't find that with a lot of other medications. And why is this? Well, it may be that the endocannabinoid system is back in balance. Inflammation is down. All these compounds are anti-inflammatories. symptoms are improving, and you just may not need as much as when you first were using the cannabis when your symptoms or your condition was a little more out of control. And so don't be surprised if you find that you can lower dosing. All right, thank you very much. I hope this was helpful for you. And here's my book again, Cannabis is Medicine. And I hope it can help you find the best cannabis regimen to help you with your ailments or your loved one's ailments. Take care, everybody. Bye.